On the RxPONDER trial, they took node-positive breast cancer patients and they randomized them to chemotherapy followed by endocrine therapy or endocrine therapy alone and looked for the recurrence score. They could only be up to 25 and looked to see whether the recurrence score was predictive of chemotherapy benefit. It was not. Postmenopausal patients, no one benefited from chemo. Premenopausal patients, everybody benefited from chemo. This analysis had about 20% of the participants who were premenopausal, had about 1,000 patients in whom they looked at serologic assays, estradiol, LH, FSH, inhibin me, and anti-Müllerian hormone. So serologic assays of ovarian function to see whether that was predictive, and it was. The AMH it was actually the only one that was really significantly associated with benefit, specifically that those patients who were, according to the protocol, premenopausal, but according to their AMH levels postmenopausal, and this is a test we use for fertility assessments all the time, it's not a new test, did not benefit. So they acted more like the postmenopausal patients, which does give some credence to the idea that at least part of what the chemo is doing is a chemoendocrine effect through ovarian suppression in these patients. But post hoc subset analysis, very intriguing though.